Hello, I'm Dr. Jody Shapiro, staff physician at Mount Sinai Hospital. This is a patient education video about elective repeat cesarean section, known as ERCS, meant for women considering their options for delivery after having one previous cesarean section. In general, women who have had one previous cesarean section have two options for delivery in their next pregnancy: a trial of labor after cesarean section, TOLAC, or elective repeat cesarean section. The first option will be discussed in more detail in a different video on trial of labor after cesarean section.
Some common reasons women chose to have a repeat cesarean section include the ability to plan in advance the date and time of the birth, the ability to coordinate your surgery with your primary physician. Having a cesarean section in the past, you know what to expect. To avoid labor and vaginal delivery altogether, to avoid the risk of uterine rupture and risk associated with a TOLAC, although there is still a risk of uterine rupture with ERCS, which is 0.03%, and to avoid an urgent cesarean section.
Despite the benefits of a repeat cesarean section from a logistics perspective, there are risks associated with it. This can include the generally accepted risks of surgery, which include infection, bleeding, blood transfusion, surgical injuries to adjacent structures like the bladder, the ureters, the bowel, increased risk of blood clots in your legs or your lungs, usually around the time of the delivery. As well, each future cesarean section carries increased surgical and pregnancy risks. The most significant risk is an abnormal placenta, which is sometimes called a placenta accreta. In future pregnancies, this can cause severe bleeding, and you might even require a hysterectomy or removal of the uterus at the time of your delivery. In some cases, you can have a TOLAC when you've had two previous cesarean sections, but this is something you should really discuss with your doctor in more detail. As well, the rate of maternal death is higher in an elective repeat section than a TOLAC, but overall it's still extremely low.
If you are planning for a repeat cesarean section, these are generally done between 39 to 41 weeks. You should discuss with your care provider what you want done if you go into labor before your C-section. Going into spontaneous labor increases your chances of having a successful vaginal birth, and many women who plan a C-section will try for a TOLAC if they go into spontaneous labor beforehand. Some women want to have a cesarean section even if they go into labor, which can be organized when they present to triage in labor. If you have any further questions about repeat cesarean section, please read our information pamphlet or discuss with your doctor. In the summary below, we have links to helpful online resources. Overall, both a repeat cesarean section and a TOLAC are safe options for your delivery, and both carry very low risks for you and your baby. Thank you for watching.